Revolutionary steps in surgery. Surgery dates back to as early as 600 BC. Sushruta Samhita is one of the oldest works in the world dealing with surgery. It indicates that Sushruta was probably the first surgeon to perform surgical operations, plastic surgery. Later, some ancient surgeons performed tooth extraction and bloodletting. Major surgery could not develop for centuries because of lack of knowledge and technology. The doctors had to cut open the part of the body that was not healthy, remove it, or set right that part. This would involve a lot of pain to the patient. General anesthetics like ether or chloroform developed only from mid-19th century, making painless surgical operations possible and successful. Modern techniques are used nowadays for anesthesia. General anesthesia benumbs the whole body and it is used for surgery of any region of the body. For local anesthesia, local anesthetics are injected into the surgical spot or an area near nerves. Over the years now, revolutionary steps have been taken in different types of complicated surgery, and these have made such operations successful. Cardiac surgery. Let us start with cardiac surgery. Today, if you need to have a heart surgery, you can choose from many fine doctors. However, before 1893, this type of surgery was unknown. Doctors did not have modern medical tools and procedures essential for heart surgery. In those days, heart patients were treated with sedatives and they usually did not survive. Then in 1893, Daniel Hale Williams, a young African-American surgeon, attempted a new medical technique in order to save a patient's life. A patient, James Cornish, was suffering from a very serious knife wound. The knife had cut an artery less than an inch from his heart and punctured the pericardium, the sac around the heart. Dr. Williams, with 6 staff doctors, performed a complicated and daring operation. Dr. Williams became the first surgeon to save his patient by successfully repairing the human heart. Now, many more advanced techniques are used in this specialty to deal with heart complications. Open heart surgery, which can help to repair heart defects, heart valves, or even replace them, is also performed successfully. With proper measures, patients can recover from cardiac surgery faster than they did before. Neurosurgery. Neurosurgery is another recent specialty to have received recognition since the early 1900s. It is concerned with the treatment of disorders of the nervous system. Neurosurgeons operate on the brain, the spine, or nerves. They can treat patients of all ages, from the newborn to the elderly, who have suffered a stroke. Harvey Cushing, 1869 to 1939, is considered to be the father of modern neurological surgery. In the early part of the 20th century, he developed basic techniques and instruments for operating on the brain as a distinct surgical specialty. Cushing dramatically reduced the mortality rate for neurosurgery from 90% to less than 10%. By the time of his retirement in 1937, he had successfully removed more than 2,000 tumors. The main reason that mortality rates had been so high before was blood loss. Among Cushing's significant achievements are the methods he developed to stem this blood loss by inventing a clip called silver clip or Cushing clip. Thus, neurosurgery is one of the most cutting edges in the world of surgery and medicine. Robotic surgery. What is robotic surgery? Robotic surgery is a type of minimally invasive surgery. Minimally invasive means that instead of operating on patients through large incisions, use is made of miniaturized surgical instruments that fit through a series of quarter-inch incisions. When performing surgery with the Da Vinci, the world's most advanced surgical robot, these miniaturized instruments are mounted on 3 separate robotic arms, allowing the surgeon maximum range of motion and precision. The Da Vinci's 4th arm contains a magnified high-definition 3D camera that guides the surgeon during the procedure. The surgeon controls these instruments and the camera from a console located in the operating room. Placing his fingers into the master's controls, he is able to operate all 4 arms of the Da Vinci. While looking through a stratoscopic high-definition monitor, the robot literally places the surgeon inside the patient. This gives him a better, more detailed 3D view of the operating site than the surgeon's eye can provide. Every movement he makes with the master controls is replicated accurately by the robot. When necessary, the surgeon can even change the scale of the robot's movement. If he selects a 3:1 scale, the tip of the robot's arms will move just 1 inch for every 3 inches that surgeon's hand moves. Utilizing this advanced technology, our surgeons are able to perform a growing number of complex surgical procedures. Since these procedures can now be performed through very small incisions, our patients experience a number of benefits compared to the open surgery of the past.